For every person, for every family, when one of their own, one of their spouses, one of their sisters, one of their mothers, one of their cousins is about or has gone to hospital to give birth or is about to give birth, there's usually joy. You've done your shopping, you've brought everything, you've put everything in check. For first time mothers, I'm sure some have even done very big occasions like this is what we'll call the baby, this is what we'll do, this is the kind of dressing we'll do, this is the kind of clinic. You've got a million plans. What a lot of people don't know is that there's usually a very, should I call it sinister, or should I call it the soft unspoken words that we are not prepared for? It has come to my understanding that many a times people even choose to go and book for a cesarean. If my memory serves me right, a cesarean is only a last option. And usually it's a last option if the normal ways of giving birth is life-threatening, or maybe it's an emergency, or maybe the baby has not positioned him or herself in a good manner, or for some other various reasons. Unfortunately, people nowadays book. And statistics have showed us that the highest number of mortality happens usually for those women who have undergone the cesarean section. In Kenya alone, the rates of the cesarean section are just on top of the roof. Now, here's the elephant in the room. Giving birth in Kenya has become such a very, very costly measure. To some extent, you hear some conversations on the streets and people are like, you know what? I'd rather go and adopt a baby. Here, you're allowed to adopt. Though, what is happening to the coming generations? Now, giving birth normally in a public hospital, if you guys are registered to the government health provider with the social health insurance fund, will not cost you around 10,000 at most. In a private hospital, it will cost you maybe 20, 30, 40 depending on the private facility. That's normal delivery at an average maximum of 40,000 Kenya shillings. Now, if you choose to go the cesarean way, we are talking not less than 100,000 Kenya shillings across most facilities. I know it's debatable, but recently that's what the study showed. Now, my question is not about that one. We'll talk about it in the next video. My question is not about the cost of this particular procedure. My question is, how sure are you about that particular hospital you're going to? Is it a registered hospital? Or is it a hospital that is recognized to perform such, should I call such big surgeries or procedures? Because many a times, a lot of deaths happen to the facilities that are not recognized. Many a times, a lot of deaths happen to the facilities that do not have proper equipment, well-trained staff, lack of gynecologists, lack of, and all those people who are usually, or you see them around the maternal wing when a mother is about to give birth. Remember, again, I advocate for no mother should die during child pregnancy. So the question I want to ask ourselves is that hospital that you see around your neighborhood, is it a recognized, registered hospital? Or is it a hospital or a clinic? Because many a times we've been told by the West that cheap is expensive. And for those who are joining me for the first time, my name is Kunguru87. Welcome to the Surviving Men series, and I hope you like this particular session. We welcome your thoughts. You can put them on the comment section. Kindly don't forget to subscribe and like this particular video. Now, I'm sure if you check around where you're living, we've got more than tens and hundreds of pharmacists or chemists. The question is, the person who has worn a white dust coat and some stethoscope, are they really nurses? Are they really clinical officers? Those ones in those hospitals, are they really doctors? Are they really qualified to be gynecologists, or are they really qualified to be medics? Because unsuspecting individuals. You don't know, you just go to them because someone else decides to start injecting you with some funny medications into your bloodstream. So the question I put it to yourself is, the way we look for reviews before you go to a particular hotel, a particular airline, a particular food or menu, why don't you also take the same before you go to any particular hospital? It's funny the way human beings, you only consider what comes into your mouth, but not the kind of medication you're receiving. A quick one, you'll have to inquire about which is the best traveling bus company from point A to point B, which is the best online cab service that I can use, a reliable where I can ferry my kids from point A to point B. Which is the best airline right now to travel to wherever the places you guys want to travel? Which is the best hotel? Where do they offer the best meals at an affordable rate? But rarely will you do research when it comes to facilities. This is where we go wrong, because ask yourself, people of the internet, ladies and gentlemen, how many times have you taken time just to inquire about this particular, the one that I'm sure where you're living right now? There are very many facilities. Some of them, you've been shocked that they offer surgeries or they offer dental or optical surgeries, or just they offer this kind of, and you're like, Recently, I went to visit another friend of mine where the wife had gone to deliver, and not in a bad way. I was really shocked. I was really shocked with that facility. First, accessing it was an issue. So I was asking myself, what happens when an emergency comes up? And simply because it was just 2 blocks away from where they were living. Yes, they delivered a very nice, lovely young baby boy. Everything was okay. Till now. It's been, I think, 48, 72 hours since the delivery. But people also forget that a lot of deaths also happen after delivery. It is not only before, during, and during. It's usually 3 phases. It starts during the pregnancy, before the delivering the baby, while delivering the baby, after delivering the baby, and also that's a span 2 months after delivery. It's all put in the bracket of maternal mortality. Mostly before, during, and after. So is it that we tend to assume a lot? Is it that we don't take care of our own bodies? I love to hear your thoughts and comments. How many hospitals, how many clinics around your neighborhood, and you guys you go over the counter and buy medication, and then you're misdiagnosed? What happens? So, ladies and gentlemen, let's take care of our bodies. Let's take care of things that revolve around us, so that we don't end up getting wrong medication. We don't end up visiting the wrong facilities. We don't end up complaining later. Because many a times when these cases happens, I'm not saying all of them, many a times you hear a person or individual has passed away, and you tend to find that particular health facility. You can't even find it on Google Maps. Yeah. You can't find it on Google Maps. Recently, there was another lady who did a podcast of the way they are actually colluding, the EMTs are colluding with these particular facilities, so that they tell you, you can't take it to this particular level 5, level 4, what hospital, because it's far and maybe it's a public place, you'll have to wait. Why don't you take it to this one, is closer? Yeah, these things are happening. The question I ask myself, we are really joking with our lives. We are really joking with our health. Even the EMTs now are to blame, because I was shocked that when an emergency arises, we are inside an ambulance, or the ambo, the way some people call it, and maybe you've been referred to this big, like for example, those who are in Nairobi, the Kenyatta National Hospital. They tell you, oh no, because of traffic, or maybe by the time you guys are reaching there, they tell the relatives, who most probably are usually accompany in that particular ambulance. It's like, do you think we should go all the way to Kenyatta? You'll have to wait, blah blah blah. Why don't you take it to this particular hospital? They offer good rates, provided you put a down payment of 2,000. The rest will be sorted out. Health is very expensive currently in our beloved Kenya. It's very, very expensive. So when it's also expensive, as much as the government is offering the social health insurance cover, and the social health assurances and whatnot. Also, take care of yourself. Don't just walk into any particular facility, irrespective of whether it's an emergency or not. Don't just walk into any particular facility seeking medication. Because I was doing a study, and the highest number of mortality rates, be it maternal, be it normal sickness, happen into these facilities that are not recognized by the Kenyan government. They're nowhere in their data. Even the people who are operating there, the staff, they're not even like certified to operate. It's like you're dealing with quacks. And unfortunately, you only realize this when a problem happens. And usually, as I said, there's usually a ticking time bomb. It's waiting to explode. And when it explodes, it makes sure it takes at least 1 or 2 fatalities. Leave alone casualties. Fatalities are usually there. So, ladies and gentlemen, people of the internet, call to action. Always do your background research where you're living currently right now. Just check the most of 3 or 4 hospitals within your neighborhood. Do some background research about them. Social media, you can try to Google them. You can try to check them up on the KMPDU portal, that is Kenya Medical Practitioners and Dentists Board Unit in the Ministry of Health. Also, you can try to check so that next time you need to tell someone or refer someone to that particular hospital or facility, you know of what. You have a backup story. You know their history. Not just because it's an emergency, someone has been burnt with hot water, someone has been involved in a minor accident or a big accident, and you guys, the first thing you think of is that because you just see the big capital H with a circle in it and an ambulance there, you think that facility is actually good. Remember, your health is your wealth. Make sure you also watch this particular video. Peace!